Hi, I'm Dr. Elna Rudolph from My Sexual Health, and we get asked about Sensate Focus Therapy very often. It is one of the most common forms of therapy that we use as sex therapists. It was developed by Masters and Johnson in the 60s, and it has really stood the test of time. There is so much method in the madness. If you are seeing a sex therapist and they are telling you to try Sensate Focus, I can really recommend it. Please remember that every therapist will have their own version of Sensate Focus. At My Sexual Health, we use Sensate Focus as part of the treatment process, particularly when it comes to patients with sexual pain, where they are struggling to be intimate because of the pain. There's so much resentment and all kinds of relationship issues, and we are trying to re-establish intimacy slowly but surely. But it can be used for premature ejaculation, for erectile dysfunction, for low libido, or for people who just want to put the spark back into their sex life and who want to learn to communicate better when it comes to sex. So this is the version of Sensate Focus that will be offered by the doctors at My Sexual Health to the patients. What we tell our patients to do is that there has to be a receiver and a giver. Now, if there's only one person sitting in front of me, I'll urge them to go and be the giver the first time. You don't want to go and tell your partner, you must do A, B, and C. But otherwise, if you're watching this together, you could flip a coin or you can decide who needs to go first. The giver needs to set a specific date and time. So the person needs to say, can we do it Wednesday night at 8? And then you stick to that appointment as if it is a dentist appointment. And you must remember, this is an exercise. You're not going to feel like, ooh, I'd love to do some Sensate Focus now. You're very likely to feel about it like you feel about exercise, any kind of exercise, where you anticipate, when you anticipate it, you might dread it a little bit. But once you get going, and especially afterwards, you think, oh, it was really worth it. I should do that again. So the giver needs to set the date and time. And then the giver also needs to set the scene. You have to choose things that you think will enhance the sensual quality of this experience. So choose some nice music, make sure the room is warm enough or cool enough. Make sure you have like a nice smelling candle there. Whatever you think will make the experience even nicer. And then you can ask your partner to prep for this session by relaxing. Both of you actually need to relax. So you can take a bath together, or you can do it separately. You can take some time to rest, or maybe to read some erotic literature. Whatever it is that you need to do to calm you down and get you into the mood to be sensual. Now, the aim of this exercise is to connect your strongest sex organ, which is your brain, with your biggest sex organ, which is your skin. And you do this in a way that you are not focused on reaching an orgasm or any other kind of end goal. You just have a sensual experience together. No sex. This isn't foreplay. This isn't a way of getting to sex. You have to agree to this. There's no pressure on either of you to then go and have sex afterwards. In fact, it's forbidden. So you start off with it's a kind of a massage, but don't think sports massage. So think of these different ways of touching. You can touch very gently like this. You can rub, you can squeeze, you can use your nails like this or like this. And then you can lick, blow, and kiss. And you can use sensual objects like feather and silk over the whole body. So the top of the hand, the inside of the hand, the inside of the arm, the top of the arm. And you include the whole body except the breasts and genitals. And the receiver can be fully clothed or completely naked, whatever they are comfortable with, and you work your way around it. If you know that your partner is very uncomfortable with touch and they would not want you to go under a shirt, for instance, if there is a shirt, respect that and stay on top of the shirt until you guys are more comfortable with this exercise. In some couples, when I explain this to them, I can just see their eyes go big like that. And we literally need to reduce this to, okay, sit and hold hands for 15 minutes in the evening. You might not be there where you can do 20 minutes of touching. If you're pretty advanced, you could include this different kind of touching on the face. That's very intimate to allow somebody to get that close to you. And then after the session, I think it's a great idea if you can kiss, like a proper French kiss, vry like we say in Afrikaans. Because, we neglect that. In long-term committed relationships, we start to neglect the kissing. So you can end it off with a bit of kissing if you want to. And then you just hold each other and let the feelings subside. And then you talk. You have to mention 5 positive things about the session. And so first the receiver will talk. And you can say general things like, I love the time that, the fact that we just spent this time together. I love the candle or the music that you chose. But you need to become more specific. So you can say, I love it when you gently touch my neck or when you kiss my neck. And remember, now we don't have genitals here yet, but we're learning to say what we like. You don't say anything that you don't like. During the session, you also don't talk at all. And you can show your appreciation with a few sounds if you want to, but don't say, oh yes, that's nice, or you only mention the positive things afterwards, and you certainly don't mention anything negative. If something is particularly uncomfortable during the session, just turn your body a bit. And that will be the cue to your partner that they shouldn't be continuing with that specific form of stimulation. And you will find that maybe some evenings you like being touched or kissed in your neck, and other evenings you might not. It is just normal. And talking about evenings, please don't try and do this exercise like 11 o'clock at night with your last little bit of energy. Please rather do it at a time when you are well rested and you have energy to invest in this important part of your relationship. So rather set a time like 8 o'clock in the evening, or then 10 o'clock on a Saturday morning if you have the privacy to do that. And then you mentioned the 5 positive things as a receiver. But the giver also mentions 5 positive things. I love touching your lower back or rubbing your inner thighs or whatever it is. And it is such an important process to give each other positive feedback. You think, oh, I'm actually a good lover. I can do A, B, and C right. I can arouse my partner by doing A, B, and C. Or actually not arouse, but give pleasure. Because remember, the point of this whole exercise is not to arouse them, but to give them pleasure and to make it sensual. And for many couples that we see, we just need to get them to a place where they can tolerate it. Maybe it's not even pleasurable at all. Maybe they're tolerating 90% of it and 10% might be pleasurable in some way. Not orgasmic, not, oh, it's blown my head off, but it is enjoyable. And then what you do after you've given the positive feedback, the other person can take a turn on the same night if you struggle to create a time and space for you guys to do these exercises. But the best is actually if the other person then takes the turn on a second date. And however you do it, the receiver at this date needs to set the time and date for the next date. You have to take turns to set the time and date. That's a very important negotiating skill that you learn in your relationship. And it forms like the basis of who initiates and who takes charge as you go forward in your relationship. So the other person then sets the next date and time. The biggest reason for Sensate Focus Therapy failing is that people don't stick to the dates. And then because they missed last night's date, they don't go and say, okay, so when are we going to do it now? They kind of both wait until it happens, and then it never happens. And then I see them again a month later and Sensate Focus has failed. But in the meantime, they just failed to communicate and to negotiate to create that space in their lives where they can be sensual. And if you struggle to find 20 minutes twice a week to be sensual, that is saying something about your priorities and how busy your life is, what's going on there, and maybe you need to rethink that. If Sensate Focus doesn't work, you're sticking to it, but it causes a lot of friction. That is the point of the therapy. We need to go and look for those places where people don't communicate well, or where there are underlying relationship issues or trauma or whatever it is that makes it difficult for you to progress with Sensate Focus, and then we can address that. Of course, Sensate Focus is there to lead to the next step and the next step. The next step, after quite a few sessions, I see patients usually at the earliest 2 weeks, usually a month after initiating the Sensate Focus. And then we will see how it goes. If everything goes very smooth and both of you enjoyed it, we will go over to the next step, which is genital exploration, where you then do exactly the same, but you include the genitals with no focus on orgasm, just using these different forms of touch to explore and to see what your partner likes. Some people like to take notes, so they will go and write, oh, okay, neck kissing, back rubbing, whatever it is that their partner likes. They actually need to write it down, the engineer type. And then the more free-flowing artistic type wouldn't want to be sticking to lists, and they will just remember what their partner said. But whatever works for you is fine. If you need to build up a bit of a repertoire, if you need to build up confidence, if your partner has been so negative about sex for such a long time, you might want to go and write those things down that you've been doing right as an affirmation. And when couples have sexual problems, there's so many negative things being said about sex over years, and that's why in Sensate Focus we don't focus on anything negative. Very, very, very advanced Sensate Focus, when you have gone over to penetration eventually, we bring in normal communication about sex, and you don't need a fancy vocabulary to be able to do this. You need very basic words. And then we focus on each other's pleasure during sexual activity. And you take turns. You don't go and both try and give each other pleasure at the same time. You take turns to give each other pleasure, but then you will start talking during sex. You don't do it during the initial phases of Sensate Focus, but later on, while your partner is busy stimulating you, you can say harder, softer, up, down, left, right, deeper, stop. And you can show them just with gentle words like that, directly to that spot or to that very specific form of touch that you like. And remember, it can also change. If you like light touch tonight, you might not like it tomorrow night. And then if both of you are comfortable with communicating to each other what will give you more pleasure tonight, you know that tonight my partner will have more pleasure if I listen to these cues, that she will have more pleasure if I just listen to her. If you can both agree to that, you can really enhance your sexual pleasure over time. So many sex therapists will take weeks of therapy before they even start to discuss Sensate Focus with couples. And then when they do, they will probably take a whole hour to explain to couples how they should do this. Take note of that. This is literally a crash course in Sensate Focus, but I think it's great. It is obviously a form of therapy, but the DIY version where you and your partner are doing this once a month just to stay connected, stay intimate, and keep on teaching each other what it is that you really like and not be so focused on intercourse but more on outer course, I think is so valuable for most couples. I hope that this video has helped you and that you have found it enjoyable. For more information about sexual health, please go to mysexualhealth.co.za, look for our blog, and there you can find loads of articles with great up-to-date information about sexual health written by actual qualified people who have a passion to help you with your sexual health. Thank you. Bye.